Hello, Assalamu alaikum. It's Dr. Dania Bushwereb, family doctor from UK, and today I'm going to present urinary incontinence. This is the English version. I've already done the Arabic version. So for people who didn't come across my channel before, basically I'm a doctor from UK, and I've decided to open this channel to increase the awareness, knowledge, and to empower you with all of the common cases which the GP sees on a daily basis, and hopefully that will help you know the symptoms and when to ask for help, etc. Okay, so we're going to start first with urinary incontinence in women. So what does that mean? It means that a woman starts to notice that she leaks urine by accident when she cough, sneeze, or when she laughs. Okay, it can be quite embarrassing, and even like for women, sometimes they find it difficult to open up to their own doctor, and some suffer in silence because of this, they feel like embarrassed. So I just want to reassure you that doctors, they see many patients a day, and most of the patients who they assist, they have like many issues which they feel embarrassed and vulnerable about. So doctors are used to it. So if you feel embarrassed and you have second thoughts, shall I tell my doctor? Just tell them straight away, because they're used to see patients, so that's fine. Okay, so going to the causes, the first and the most common cause is uterine prolapse, which is secondary to age and also to childbirth. So childbirth, when I'm saying childbirth, I mean like normal delivery, okay, not C-section, especially if it was like a complicated delivery, and also like if like there was like many deliveries, if the woman had like a lot of children, or if she had like, as I said, like complicated prolonged delivery with instruments, okay, that can lead the uterus to prolapse. So if you just ignore all of these pictures, just this one, okay, so this is the uterus, it should be up here. So as you can see, it's prolapsed, and what it's doing, it's pushing on the urinary bladder. So this is the urinary bladder, this is the uterus, and this is the large intestine, okay, the end of the large intestine. So when you have like a prolapsed uterus, it's when it pushes on the urinary bladder, that can, anything which pressurizes on the bladder, that can cause it to leak urine by accident. So again, if you go to this picture, we can see this is the pelvic floor, right? So if you imagine you have the bladder, urinary bladder, it's like a balloon which has the wee pipe coming out of it, okay? So this balloon, it's sitting on the pelvic floor. So if you see here, okay, so this is the pelvic floor. You have the pelvis, you have the pelvic bones, and then you have the pelvic floor, which contains of muscles. So what happened by, as I said, by age and by like childbirth and all of that, the muscles of the pelvic floor, they become weakened. And when they become weakened, remember I told you about the bladder where it's like a balloon, and it's all held by the pelvic floor. So when you have a weakened pelvic floor, what happens to this balloon? It's not held very well, so that's why it leaks when somebody coughs. Okay, so that was the first cause of urinary incontinence, the most common one. Going to the second one, as we know, of overactive bladder. A lot of people suffer from overactive bladder. So it could be because of like drinking loads of caffeine drinks like coffee, tea, or even like fizzy drinks, dark chocolate, or even like alcohol can cause that. I know in Arab countries they don't drink that much alcohol, but from my experience in UK, alcohol, a lot of patients with alcohol, they can suffer from this problem. Or sometimes even nerves. There are theories that say even like nerves, it can it's related to nerves controlling of the bladder. Diabetes mellitus also can cause that, which is increasing in blood sugar. Sometimes even fibroid or ovarian cyst. So what is a fibroid? It's a benign tumor of the uterus So remember, when going back to this picture here, so if you have here, that's the bladder, which is like a balloon, okay, which is full of urine, and then you have the uterus. So if you have anything in the uterus, whether it was a benign tumor like a fibroid, or if you have a tumor which is malignant, or if you have a malignancy in the ovaries, or if you have a cyst in the ovaries, anything which can put pressure on the bladder, that can cause sudden leak, okay? And then also the sixth one here, you have weight gain, so especially around the tummy. So if somebody has like weight gain, again, why? Because it's going to put pressure on the bladder. And then of course UTI, like water infections, as we know, can cause this problem. So when you go to your doctor, they will ask you these questions. They will ask you, well, did you drink alcohol? Did you drink coffee? Did you put on any weight recently, especially around your tummy? And then they will screen for diabetes. They will tell you, well, did you feel thirsty more than normal? Did you wake up at night needing to pass urine? Did you notice that you're passing urine more often? Are you feeling watertight, fatigued? Do you have any blurring of vision, or any family history of diabetes? Okay, and then they're gonna also screen for water infection. They're gonna see, well, do you have any dysuria, like which is pain when passing urine, any burning sensation with passing urine, any history of recurrent water infections before, any pain in the loins, which are the lower back, the lower size of your back, okay, where the kidney is. And then also they're gonna ask history about, like, did you have any babies, about how was the delivery, was it C-section, was it normal, was it complicated, was it instrumental, and of course also before he will see you, he will know your age by checking the records. So as I said, like women, like most women like above 70, they have some kind of urinary incontinence and a bit of prolapse, even like uterine prolapse. And it's natural. That's like a natural process of aging. Your doctor will also ask you some red flags. Okay, so any person with urinary incontinence, any woman, they have to ask you that. So what are the red flags? Any blood in the urine? Of course, they will ask you, like, do you still have your periods? Did you notice you had that blood in the urine when you had your periods or not? Or did you have you hit the menopause? So if you have hit the menopause and you have bleeding, so that's postmenopausal bleeding. So that's a red flag. So that actually needs referral straight away. Okay, to gynae. Or if you had any bleeding after sex, these are all red flags. Okay, but blood in the urine also that's also a red flag. So why is all of this is red flags? So because we don't know. Any blood in the urine, well, it could be maybe a cancer in the bladder. It could be cancer in the uterus. It could be cancer in ovaries. Okay, but it could be, it's not, I don't want to frighten you, because blood in the urine can be a water infection. Even water infection can come with blood in the urine, or a trauma. So not necessarily, or could be maybe a period. Or maybe like if they're on contraception or on hormonal, like if they have a coil, marina coil, something, a hormonal which is causing a bit of spotting and bleeding. So again, it could be something like mild, but it could be something serious. But again, but this is the red flag. But so the doctor will ask you about that. And then also they're going to ask about family history of, do you have any uterine and ovarian cancer, etc., or any bladder cancer. Examination, they're going to do three things. First of all, they're going to check your tummy, make sure you don't have any lumps or bumps. And the reason why they're going to check like your ovaries when they examine your tummy, you see like if you have a cyst, if you have like any lump there. Again, also they're going to check for any lumps and bumps on the uterus or the bladder. And then they're going to do an internal examination, vaginal examination. They're going to look for any prolapse and also check the cervix, like your uterus. They're going to check and make sure there's no cancer or anything. And then they're going to dip your urine. They ask you, please bring a urine sample. They're going to dip it and check for any sugar, if you have any sugar, or if there's it shows any infection. And they're going to treat it after that. So treatment, as you saw here, there's like loads of causes for urinary incontinence. So it depends on the cause, okay? So let's say if somebody has a red flag, as I mentioned, the doctor straight away, they're gonna exclude infection, and if there's no infection, it will be a referral, okay? And then if it was like an overactive bladder, if it was an overactive bladder because of coffee or alcohol, or they're going to ask you, or fizzy drinks, they're going to ask you to cut that down. Another thing, following the national UK guidelines for treating urinary incontinence, your GP will give you, or your family doctor will give you a bladder diary. So bladder diary, it's usually like a paper where your doctor can give you, or even like you can write it in Google. If you're not in the UK, it's easy, you can just write in Google and print it out. So what's the idea about bladder diary? It's, you're going to write all of the fluids which you drink in, and even like the fluids which goes out, the wee. And if there's any leaks or accidents to be documented, we know that it's not something easy to be done, but the bladder diary actually, or the bladder leaflet, will really good, will give a good idea about, like, if you're having any accidents or leaks or anything like that. Then after having like the bladder diary, after discussing with your doctor, then most likely they're going to give you a chance of treating your problem without medications. And that will be Kegel exercise, like pelvic floor exercise. Remember when I said earlier about the weakness in the pelvic floor and the muscles, all of that. So you can strengthen them, especially like women who have like who had like a normal delivery. It was a bit complicated. So you can start them by yourself, or if you're in the UK, it's usually sometimes they refer you to the physiotherapist who can help you. She can give you a leaflet which has like the Kegel exercise, and you can do them in your own time at home. And they usually have like a really good like successful rate. Okay, if that doesn't work, sometimes giving like a low dose of a drug called duloxetine. It's a painkiller for nerves. Duloxetine, it's they used to use it before like as an antidepressant, but it also has another use, which is a painkiller for nerves, and that can help with overactive bladder, with the nerves, with the bladder being a bit sensitive to the nerves. So let's go back to the causes. So just make sure that we covered all of the treatment. So as I said, like about alcohol and coffee, if the problem was that somebody like put on weight around the tummy, of course, like losing weight with exercise will really help. If your doctor discovered that you have diabetes, of course they're gonna treat that. And if there was like water infections, it will be treated. And if that's the first line treatment in the GP land. But of course, like if things are not like if things are like out of control or anything, or if it's like the urine incontinence is quite severe, or all of these like methods, like which is exercise and a trial of medication doesn't work, sometimes even like a second opinion, like referral to a urogynecologist can help. So if you have any questions, please write them in the comments, and thanks a lot for listening. Okay, thank you, bye.